Today I am going to talk about a very important topic called delirium in ICU. What is this delirium in ICU? This is the most negligent syndrome which occurs in a patient who are getting admitted in the hospital or especially in the ICU. But if not diagnosed early and are treated, these patients can have a devastating complications. It's a syndrome. Basically, the patients will have fluctuation in the conscious level along with change in the cognition. So these patients usually they have impaired attention, impaired cognition, and then the patients having the fluctuation in the conscious level. If you take the prevalence of this delirium, if you take the general literature, those patients who are getting admitted to the ICU, up to 33% of the patients can develop delirium. But this can go high as 75%. So the patients who are getting admitted to the hospital, they will not be having delirium. They come with different problems, but once they get admitted, they can develop the delirium. So there are so many comorbid conditions which increases the risk of delirium, such as old age, male sex, the patients who are admitted for the fracture, post-operative patients who are having hip fractures, the patients having respiratory complications, patients having acid-base disturbances, patients having electrolyte disturbances, those who require high vasopressor support, or the patient who requires opiates and benzodiazepines, or the patients who are getting recurrent fevers. And some other factors which contribute to delirium are patients will be nursed in an environment where we are not accustomed to those kind of environment by the patients, who are not aware of the time, like they may not be knowing whether it's a day or night. Patients like in ICU, they'll be having continuous light or the continuous sound, or the patients who are getting repeated fevers, patients who are giving multiple drugs. So these are also risk factors which helps in development of the delirium. So if you see the types of delirium, these patients can have hyperactive delirium, where the patients will be very agitated, restless. Sometimes he'll try to abuse or you try to pull out all the lines. Other type of delirium is hypoactive delirium, where the patient is lethargic, less attentive, or he will be very depressed. Sometimes the patient can have both kind of delirium. So this is very, very important. Why we are discussing about delirium? Because if you don't identify the patients in the ICU early, or if you don't treat the patients, this can lead to many other factors, such as it can increase the length of stay in ICU, average length of stay in hospital also increased, the duration of ventilator also increased, or the financial burden on the patient will be increased. Overall, it has high morbidity and mortality on the patients. So to identify this, we have some checklist called continuous assessment method or conscious assessment method in ICU, known as CAM ICU, or the delirium screening checklist. So if you diagnose early, we can manage the patients with simple medications. They are haloperidol and dexmedetomidine. So in our hospital, whenever the patients get admitted to the ICU, we screen the patients who are at risk for developing delirium, and then at frequent intervals, patients will be monitored for the development of the delirium. So we have all the proper checklist and all the specialty to identify early and manage the delirium successfully, so that we can prevent the increase in morbidity and mortality of the patients. Thank you.